Okay, we're continuing with the book here, Prevent and Reverse Afib and CHF by me, Pete Rogers. We're on page 100. We're going to be talking some more about Caldwell-Esselstyn. He's got the best results of any doctor in the world for reversal of coronary artery disease, prevention and reversal. This was his book. It's a great book. It's called Prevent and Reverse Heart Disease. And one of the things I really liked about him was he emphasized go in 100%. You know, because you want to be successful. The idea of a recommendation with a diet is not that you can pamper all the mediocre dummies who want to half-ass everything. I don't really care about them. They really shouldn't even watch my channel, okay? If you want to be successful, this is what you do. And let's say you do the Esselstyn diet 100% and your total cholesterol drops down to 90. Well, then you can ease up a little bit. But if you're worried about having a heart attack, you want to get your total cholesterol down as fast as you can, optimize everything. And like I said, it's always easier to dial back than it is to half-ass it going in. I think that's a big mistake. So I like Esselstyn. He used to say, no oil, not one drop. That's good. That's the proper way to talk to people. And McDougall emphasized this as well. You don't tell an alcoholic you can drink on the weekend. You tell them you don't drink anymore. If you want to be healthy, you don't drink anymore. You don't tell a smoker you can smoke on the weekend. You tell them if you want to be healthy, you don't smoke anymore. There's all kinds of little bad things that are happening due to toxins you're exposed to, EMF and other things that you can't control. So everything you can control, you want to control it 100% if you want to age well. Otherwise, you know, you'll probably end up fat, sick, and stupid like most people by the time you're 60, if not sooner. Okay, so what are some other things Esselstyn said? He had 4 years follow-up. He had 99.4% of his patients with no cardiovascular events. His results were 30 times better than the Lyon study with an optimized version of the Mediterranean diet, so that's extraordinary. He says that he's never seen a single patient who actually followed his diet correctly ever have a cardiovascular event. He did show some people who reversed it, you know, significant stenoses. If you got soft plaque, you can reverse it. Hard plaque, you're going to be much less likely to reverse. He recommended no caffeine, no oil, not one drop. And then people say, oh, well, isn't your diet extreme? And Esselstyn would say, you know, 500,000 people every year go for open heart surgery, CABG, coronary artery bypass graft. And they have their chest open up with a rotating buzzsaw. They take a vein from their leg and they sew it onto their coronary arteries. They also drop the left internal mammary artery to the left anterior descending. That's called the Lima to the LAD. And they don't think that's extreme. You know, that's crazy compared to just eating plant foods that we're supposed to. He says coronary artery disease is a paper tiger that need never exist. You can take control of your health with a low-fat vegan diet with no oil. It's like make yourself heart attack proof. Why wouldn't you want to do that? You'll no longer have the sword of Damocles hanging over your head. Yeah. Why not? Low-fat vegan diet has 0% morbidity, 0% mortality. Yeah, there's no side effects except good ones. Your body weight optimizes, you minimize diabetes, you minimize hypertension. Why wouldn't you want that? Okay. Then years later, after his original work, he started talking about recommending people chew on greens all day so they can get more nitric oxide. As they get older, they make less nitric oxide spontaneously from their arterial lining endothelium. But when you chew it, it's got plant food's got nitrates. Okay, they get converted to nitrites. Nitrates are NO3. They get converted to nitrites, NO2, go down into your stomach. Stomach acid helps convert them to nitric oxide, NO, and that's absorbed systemic nitric oxide, vasodilation throughout your body. Okay, so that's what he recommends if somebody's a really high risk. A regular risk person doesn't need to do that. Let's see. He also started later on recommending people eat flax, but I think that's a mistake. I think he just didn't read that careful. He's a little bit of a one-trick pony sometimes. And he was saying, oh, well, you'll get your omega-3s. You don't need your omega-3s from flax, okay? Then once you start going down the path of flax, you start causing all kinds of other problems. So that sounded like a mistake, rather stupid to me. I strongly recommend people avoid eating flax. It's about 60% fat. It's associated, it's like Tweedledee and Tweedledum the soy, associated with premature puberty, goitrogenic, high fat, estrogenic, all kinds of bad things. Let's see. It's another one of those, you know, billion-dollar profitable foods. Okay, I recommend don't ever eat that stuff. Olive oil, canola oil, any oil, omega-3 oil, soy nuts, seeds, any powder foods, coffee or tea. They're all bad. You know, if it weren't for the fact they were corporate profitable, nobody would even bother with them. It's like, you know, there's no benefit to any of that stuff. Caldwell Esselstyn quotes again, oil is toxic to your arteries. Don't eat anything with oil in it. Moderation kills. You only see heart disease in countries that eat a lot of meat and oils. Coronary artery disease is a foodborne illness. No oil, not one drop. Yeah, that's good. That's how you get good results. You do everything you're supposed to. And other people say, well, I don't know if I could live like that. My advice would be just try it for a couple months, okay, and see what happens. You know, people say, oh, well, why would so-and-so recommend oil? Well, most of the people don't know what they're talking about, and the few that do, they probably don't care about you, you know, unless, you know, you have Christian ethics, and most people in the healthcare business don't. They have no obligation to you. As far as they're concerned, they go by atheistic Darwinism. You're just a talking monkey. Why should they care about you at all? They need to please the insurance company. They need to please Big Pharma. They need to please the hospital corporation. They don't need to please you. You really don't matter. What can you do? All you can do is say thank you. That's nice, but you can't pay their bills. You can't protect them from med malpractice. You can't do anything. So the patient really doesn't matter is how the healthcare system works. Okay, Voltaire had said, I want my doctor and my tailor to believe in God so they do not rob me. The lawyer Anton Chekhov said, what is the difference between a lawyer and a doctor? A lawyer will rob you. A doctor will rob you and kill you. Okay, here's a paper showing something that's a little bit interesting about coronary artery disease. These are the big arteries on the outside of the heart. First, here is the ascending thoracic aorta, and then the coronary arteries come off of that. Here's the left main, the widowmaker. If you block that one, that gives rise to the left circumflex artery going around between the atria and the ventricles, you know. Okay, then there is the left anterior descending. That's the big, most important one. Goes right down the anterior surface of the heart over the ventricles. Okay, this is just showing a normal variant. You can get instead of having a bifurcation of the left main, you can get a trifurcation with an extra branch called the ramus intermedius. The relevance is when that is present, the circumflex and the LAD will be a little bit smaller. The smaller the artery, the harder it is to put a stent in it, the more difficult it is to do a surgical bypass to it. So this will worsen your prognosis in terms of ability to fix with a cabbage or a stent. In addition, you got these small arteries that go into the muscle, that penetrate. Penetrating arteries going into the myocardium is the other name for cardiac muscle, so they're called intramuscular arteries, intramyocardial arteries, penetrating arteries. And the point is, you can get amyloid clots going into those things and blocking those up, and that can contribute to AFib. And you can get a cardiac cath. If these guys are diseased, but the outer surface, the epicardial, the big ones on top are open, you'll have a clean cath, but you'll still have significant coronary artery disease in the myocardial branches. Not good. So that's why you want to do everything right so you avoid a problem in either one. Okay, here it is. Ramus intermedius, that third branch trifurcation of the left main, increases the risk of atherosclerotic plaque at left main bifurcation region. Let's see. Ramus intermedius was identified in almost a third of patients. It increases plaque formation in the distal left main, not good. They said it had 8.5 times increased risk of atherosclerosis in the distal left main if you had a ramus intermedius, and 1/3 of people have it. That's what I mean. You could have one of these unfavorable anatomies, congenital anatomies, so you're at increased risk. So why do things half-assed? Why not do things optimally and minimize that risk? Okay, so that's it for the chapter on atherosclerosis and coronary artery disease, so we'll stop there for today. I hope you found that helpful.